Hi everyone, we are Group 8 and today we will be discussing California's Medi-Cal expansion to undocumented Latinos. This is an important health equity issue because undocumented individuals have historically faced barriers to accessing comprehensive health care. We'll discuss the expansion, its strengths, limitations, and impact, as well as recent policy changes that may affect access to care. I'll begin by explaining the health disparities that existed before the expansion. Before California completed its Medi-Cal expansion in 2024, immigration status was an important structural barrier to comprehensive health care. Undocumented adults were less likely to receive employer-sponsored health insurance because many worked in industries that did not provide coverage. Without comprehensive insurance, people may delay primary or preventative care and have greater difficulty managing ongoing health conditions. This disparity is important when discussing Latino health because approximately 86% of California's undocumented population is Latino. So, although the policy concerns undocumented Californians of different racial and ethnic backgrounds, its effects disproportionately involve the Latino community. This helps explain why access to Medi-Cal is both an insurance issue and a health equity issue. Our case study focuses on California's expansion of full-scope Medi-Cal. Medi-Cal is California's Medicaid program for eligible low-income residents. California expanded coverage in stages, beginning with children under 19 years old in 2016, followed by young adults ages 19 through 25 in 2020, and adults 50 and older in 2022. The final gap was adults ages 26 through 49 who became eligible for full-scope Medi-Cal regardless of immigration status in January 2024. A major strength of this policy is that it directly addressed a structural barrier to health insurance by removing immigration status as an eligibility restriction for this population. However, eligibility alone does not guarantee access. Undocumented immigrants can still experience barriers such as difficulty navigating the healthcare system, language barriers, fear related to immigration status, and challenges finding care. The overall impact was therefore significant because California expanded comprehensive coverage to a population that had previously been excluded, while also showing that insurance expansion is only one part of achieving equitable access to healthcare. The importance of the 2024 expansion becomes clearer when we compare limited coverage with comprehensive coverage. Before the expansion, many undocumented adults ages 26 to 49 could not obtain full-scope Medi-Cal simply because of their immigration status. Having coverage for emergencies is equivalent to having comprehensive health insurance. Comprehensive coverage creates greater opportunities to establish a regular source of care, receive preventative services, see a physician before a condition becomes severe, and obtain ongoing treatment for chronic illness. The distinction is supported by Bustamante and colleagues. Their findings suggest that Medi-Cal can help people without citizenship or green card status overcome barriers to help utilization. This makes the 2024 expansion important, not simply because more people possessed an insurance card, but because that coverage could translate into actual use of health services.
So, let's talk about some early impacts of expanded coverage. So, prior to this expansion, most of the 12 participants already had some form of coverage, which was often, however, limited to certain conditions and emergencies. When many of these participants were told about the Medi-Cal expansion by their physicians, however, many people really didn't believe it was real until participants received letters from the state with contact information for enrollment support. So, of these 12 participants, 9 were from Los Angeles and 3 were from Orange County. Those from Los Angeles actually already had access to a bit more of a full coverage insurance because of some program in Los Angeles. However, those in Orange County found it more difficult to find insurance that wasn't just for emergencies, and it was often a lot more expensive out of pocket, whereas those in Los Angeles didn't really have to pay much. So, the majority of these 12 participants enrolled successfully thanks to the enrollment contact information that was provided, which made it a lot easier for these participants to join in the first place. However, there was one person, 50-year-old Javier, with type 2 diabetes, who was denied. He applied repeatedly and got help from the contact information people with the enrollment support, and he was still denied multiple times. He had no medical, well, at the time of this study, he had no medical attention for a year. Who knows what that may be now? And he actually told the those collecting information for this study that he actually often bought his medication off of other people who also had type 2 diabetes because he needed his medication. However, despite this, the study found that participants expressed fewer financial worries about seeking healthcare services and an increased sense of emotional security that they would not lose access to healthcare. So, what does Medical look like in the community? Applying and renewing Medical can be extremely confusing for the average person, especially with all these new changes that have come to it. So, there is something called promotoras. Promotoras are community health workers that are trained to help guide people through the entire process. They can meet you in your neighborhood and explain benefits in plain language as well as help with medical applications. For example, Rosa Lopez is a promotora in Long Beach who says that many immigrants are afraid of losing coverage. However, she insures them and supports them and tells them that they're going to do everything they can to put their health first before anything. So, what are some access gaps? So, although a lot of these people did get access to healthcare in 2024, I believe it was, as of January 1st, 2027, immigrants over the age of 17 will move to a fee-for-service medical, which limits some coverage. So, if you're over the age of, it will be discussed later, but there's a bit of a change with the age as well about reapplying and whether or not you're able to apply or not, which will be talked about later. However, adults who are aged 19 to 65 must prove that they are volunteering or working at least 80 hours a month in order to continue to qualify for Medicare. This group must also begin to pay a $30 minimum monthly fee. And beginning July 1st of 2027, all the adults will lose dental coverage, unfortunately. And Medi-Cal eligibility will need to be checked and renewed every 6 months, which will be difficult for a lot of people to keep up with this, especially on their own. Luckily, there are systems and groups like the Panteras that promotoras that help you. However, that's not the case for everybody, and unfortunately, this is only going to create more gaps in the system for access to healthcare because a lot of people, it's really difficult, especially with there could be a language gap or just a lot of things that are contributing to this renewal of every 6 months. Somebody might forget and then no longer be qualified to ever try to apply again and then only have emergency care. It's just very difficult, and there's a lot of access gaps, unfortunately, that are going to continue for many Hispanic and Latinos in the California communities.
Okay, now we're gonna be moving on, and I'll get started with explaining the 2026 enrollment restrictions. I just want to say my name is Nestle Velasco, and this is what I'll be covering. So on the right side of this presentation, I included the medical visual that summarizes the main changes. So as of January 1st, 2026, many undocumented adults aged 19 and older who were not already enrolled could no longer apply for full scope Medicaid. Even if they met the income and California residency requirements, they may only qualify for restricted scope coverage. Current members are not automatically removed though. They can generally keep their full scope coverage if they remain eligible and renew on time. Now, children under 19 and pregnant individuals through 1 year postpartum and also qualifying foster youth also remain eligible. And although this policy affects immigrants from many backgrounds, our presentation, as mentioned earlier, focuses on undocumented Latino adults. So this community may already face systemic barriers like language differences, limited access to providers, fear and difficulty navigating health systems. So additional coverage restrictions can make access even more difficult. The visual also mentions additional changes expected in 2027, including reduced dental coverage and possible monthly premiums for some adults. These changes are important because they suggest that the 2026 enrollment freeze may only be the beginning of broader limits on medical access and affordability. Now moving on, these next slides focus on maintaining coverage after the freeze. So in the top, in the blue boxes, it shows what people who already are enrolled, well, they're able to keep their full scope medical by renewing on time and continuing to meet eligibility requirements. Now the yellow boxes in the middle shows that if coverage ends because of missed paperwork or a renewal issue, the member has a 3-month period to correct the problem and restore coverage. The red boxes at the bottom, they show what may happen if the period is missed. The person must reapply, and because of the new enrollment is restricted, many affected adults may only qualify for restricted scope Medi-Cal. This makes the renewal deadlines especially important for undocumented Latino adults who may already face language or system navigation barriers because a missed notice or incomplete renewal could lead to loss of primary care, access to medications, preventative services, and also ongoing treatment that they may need. So why was coverage restricted in California in the first place? Well, California mainly restricted it because of financial pressure. The state was working to close an approximately 12 billion budget deficit, and medical costs were higher than originally projected. So freezing new enrollment was intended to reduce future spending while allowing many current members to remain covered. Immigrant health advocates actually viewed this decision as a setback because immigration status once again affects access to comprehensive coverage. So they argued that people with similar income and medical needs may receive different levels of care. So overall, the 2026 policy did not completely end the 2024 expansion, but it narrowed who could benefit from it in the future. This leads on to the next section on health outcomes and health equity.
As discussed in the previous slides, undocumented individuals living in California will face changes to health coverage in the upcoming year by restricting new enrollments. The budget restrictions will create barriers that disproportionately affect Latino immigrants because Latinos make up 86% of the undocumented population in California. We will see higher rates of uninsured, undocumented adults in the upcoming years. Now, what are the health consequences of limited coverage? The enrollment restrictions will lead to barriers in care, fewer preventative services, and an increasing financial hardship for undocumented populations in California. This will cause worsening health outcomes because it delays care and leads to an advanced disease when newly diagnosed. It will also lead to lack of treatment and management, especially for those with chronic diseases that require long-term care. As stated on the bottom, health coverage isn't just insurance, it's equity. Now, why is this an equity issue? Health equity means that everyone has a fair opportunity to be as healthy as possible. Immigration status should not determine who can receive care. When policies remove barriers based on immigration status, communities become healthier, stronger, and more just. The Medi-Cal expansion in 2024 closes existing gaps in access and use of healthcare. So the new enrollment freeze will slow or reverse these trends, increasing the barrier again based on status. What this policy shift means. So for California's 2024 Medi-Cal expansion, it showed how public policy can reduce health disparities by removing immigration status as a barrier to healthcare. However, the 2026 enrollment restrictions will risk reversing many of these gains by increasing the number of uninsured Latino adults, delaying care, worsening chronic disease outcomes and widening health inequalities that the expansion was designed to reduce. So because the undocumented immigrants in California are largely Latino, expanding Medi-Cal increased access to preventative care originally, increased chronic disease management, mental health services, and financial protection for one of the state's most medically underserved populations. Thank you for listening to our presentation. These are our references.